Good morning everyone. I am Dr. Krishna Saiti. Today I am going to present a paper on a comparative study of stereoacuity in different grades of cataract and bilateral pseudophakics. Stereopsis is the ability to perceive an object in three dimensions due to desperate stimulation of retinal elements in the eyes, but not to an extent where the diplopia occurs. For each person, there exists a minimum amount of disparity for three-dimensional view of image, which we call it as stereoacuity. Three-dimensional vision is the highest level of binocular coordination required in day-to-day activities and more precisely in some professions. A number of studies have described reduced stereoscopic function in older people, where one study described a catastrophic drop in stereoacuity over the age 60 years. The purpose of my study is to know whether the cataract has any influence on stereoacuity and to compare the stereoacuity changes in people with different grades of cataract and bilateral pseudophakics. This is a cross-sectional observation study done at Medical College and Hospital in Andhra Pradesh during May 2017 to 2018. This includes a sample size of 200 with 4 groups. The first 3 groups includes the cataract based on LOX3 classification, and fourth group include the bilateral pseudophakics with monofocal IOLs. The stereoacuity was measured by a single examiner using Titmus fly chart and a full refractive correction wearing Polaroid glasses at 40 cm, and the patient was asked for which circle is in different plane of other circles, that is towards them. The inclusion criteria is patients with senile cataract aged more than 45 years. Exclusion criteria include single-eyed patient, glaucoma, squint, or any posterior segment pathology. The statistical analysis includes the descriptive statistics and one-way ANOVA using SPSS software, and p-value less than 0.05 was considered as significant. These are my results, which shows the overall stereoacuity as measured by Titmus fly chart declined with increased grades of cataract. The post hoc analysis for relation between cataract and stereoacuity was also done, which shows the group 3 shows significant drop in stereoacuity compared to other groups. Discussion. Our study reveals that there is a definitive reduction in stereoacuity with progression of cataract. The study also showed there is a better stereoacuity in bilateral pseudophakics with full refractive correction than stereoacuity with high grades of cataract. The studies of Manoranjan A. et al., Hayashi K. et al., and Lewis et al. All observed the stereopsis in bilateral senile cataracts and after IOL implantation showed significant improvement in stereoacuity, but they have not mentioned any stage of cataract where the stereopsis was significantly decreasing. In this study, there was a significant drop in stereoacuity in high grades of cataract when compared with mild grades of cataract and bilateral pseudophakia. But no significant difference in stereopsis is seen between mild grades of cataract and bilateral pseudophakia, so there may not be much improvement in post-operatively for mild cataracts. The limitation of the studies, it was not observed with other available studies, tests like Langs and random dot. Finally, the conclusion of the studies, the stereoacuity decreases with increasing grades of cataract, and better stereoacuity was seen in bilateral pseudophakia when compared with high grades of cataract. These are my references. Thank you.